I'm Dr. Jamie Wright. I'm traditionally trained as a board-certified obstetrician gynecologist. I practiced OB/GYN for about 5 years. About 2.5 years ago, I began to realize that I wasn't getting people to the level of wellness that I wanted to see them, and began to look for other options. About 1.5 years ago, I joined the Fellowship of Anti-Aging Medicine, and have radically transformed my career through anti-aging medicine. Yeah, I think my philosophy tends to be take the best of everything. This is not a us versus them. This is not traditional medicine's bad and nutrients and herbs are good. This is really thinking out of the box. This is realizing that people are sick for a reason, kind of in an unprecedented way. And so we need to look deep under the covers and say what's really going on here, and looking at practical physiologic type of testing. Functional testing is one way we can dig under the covers and see what's going on with people. Functional testing is probably more of a generic term that we within the integrative medicine community use to describe tests that have a very practical application. Meaning these tests tell us what's going on with the body's physiology in a direct or indirect way. I think maybe the better way to ask that is, what's the role of lab testing? And the way that I use lab testing is, what am I doing it for? What are we looking for? And how are we going to apply the information we get? So I think that most lab tests can be useful if you're activating your brain and actually using it. So yeah, there is synergy and overlap between traditional testing and functional testing. I hope so. I think that what's going to drive that is the patient demand. People intuitively know something is not right, and they know that going to the doctor over and over again and getting the same answer, which has not helped them in the past, doesn't work anymore. So, doctor, I'm fatigued all the time. Well, you have chronic fatigue syndrome. They know that it doesn't mean anything. And I think that fundamentally many doctors are now realizing that having those kind of patient interactions is unappealing. Clearly our environment has changed dramatically in the last 100 years. It was in the 1940s when doctors began to recognize the link between pesticide use, processed food, and autoimmune disease. We have fundamentally changed the way that we eat, live, deal with food, the air we breathe. There are drugs and pesticides found in the Antarctic, places that humans have basically never lived. And so the toxins or the foreign substances are embedded throughout our entire environment now. Babies are born, when you check a fetal blood or a neonatal blood sample, they have over 300 foreign toxins in their bloodstream at birth. So that has to do something. Our body is infinitely able to adapt, and we do adapt. Unfortunately, the downstream effect of that and the compounding effect is systemic disease and autoimmune disease. I do use ALCAT testing in my practice. I think that ALCAT testing probably should be considered more useful than a CBC. And should be routinely used in that manner, because it's actually a test that a patient doesn't need a physician to deal with. It's practical, immediately applicable, and can be life-changing. And the first test that I ever ran was on my wife. And as many of you know, my wife has been through 5 years of peculiar symptoms, misdiagnoses, and some fairly tragic health issues. I used functional medicine concepts and not a lot of testing and nutrition to get her off about $500 of prescription drugs a month. She got more energy, improved, but the chronic pain she had and the chronic inflammation I couldn't really do much with. We did an ALCAT test on her, and my wife was 34 years old when we did this. She had complete resolution of her pelvic pain and arthritis within 10 days of going off the foods. In fact, we were in Las Vegas 1 year ago right now, and it was 30 degrees, and she was able to walk without assistance for the first time in 3 years in cold weather. It was dramatically life-changing. However, I will share that 2 months later, she developed autoimmune thyroiditis and Graves' disease, and that was a huge setback for us. However, we've persisted in believing that she can be healed, and this is, again, where traditional medicine has helped, because I can't cure Graves' disease with a vitamin. We have to help her immune system reset and regulate itself. So she's back on some different drugs to control the thyroid, and we have been cleaning up her gastrointestinal system. We've repeated ALCAT testing, which completely changed, opened up a lot of foods for her to eat, and we're using some other modalities to get her well. She has been a propelling force in helping me help many other people. A woman was sent to me by a chiropractor who is fabulous. He's a brilliant chiropractor, focuses a lot on neurology. This lady had been to about 11 doctors. She was on 6 or 7 medications for what was called fibromyalgia. She weighed about 260 pounds. She came to me in February of 2010, and she said, all I want to be able to do is to play with my grandkids, let them sit on my lap, and drive my bus route. I did, this lady, I took her off gluten, put her on some simple nutrients, and put her on a 1,200 calorie diet. A month later, she came back, and I didn't recognize her. The swelling in her face was gone. She lost 25 pounds, and she told me in 3 days my fibromyalgia washed away going off gluten. So I was sitting there with her at that visit with the ALCAT results in my hands, and I thought that she had been doing ALCAT, but she hadn't. She had just gone off gluten. She went on to implement the ALCAT diet, and 6 months later, she had lost 61 pounds. She looked stunning, and her chiropractor was over for a birthday party with my children, and he said, Jamie, I thought when I sent her to you, I thought she was going to die. And that lady was just in my office, and she said she's going down the water slide with her grandkids. That's true life change. Gluten's a big issue in our culture, and I don't think we have a lot of clear answers as to why. I think one issue is that it's everywhere. They put gluten in gummy bears. They put gluten in lipstick. It may also be due to the hybridization of grains, changes in the way we grow grain. Either way, we clearly have a problem with gluten and its ability to ignite or inflame the immune system. People struggle with gluten because we're used to eating food-like substances. I try to teach many of my patients, we don't eat food anymore. We eat food-like substances. You know, God didn't grow a granola bar off of a tree. And so I try to get them to go back to some simple concepts. Think about real food. How did your grandparents eat? How did you eat when you were a child? And begin a slow, methodical process of getting them to think outside of their box. I think one of the great things about using ALCAT is that it does get patients immediate momentum. One thing I like to do is to do some simple things. I like to do you heard of the 80-20 rule? I like to do the 5-95. Let me find 5% of things that might get them 95% momentum. Let me find 20% of things that will get them 80% better. Keep it simple. Get momentum going. So that's some decent, simple nutrition, pharmaceutical grade nutrients, and giving them something that they can practically implement, like the ALCAT test. I will say though, many people have multiple food sensitivities. If the ALCAT test is overwhelming, pick a dozen foods to start with. In my humble opinion, everyone should have an ALCAT test. It's practical to everyone. It helps reduce inflammation in the body. It helps people to really target what kind of foods are uniquely beneficial and not to their body. Our cells know what to do with these foreign substances, but the problem is it leads to disease. So we are adapted to our environment because we're surviving. The issue is, are we optimal? Because this type of healthcare is about health optimization. It's not just about getting there. 70% of Americans are overweight. 50% of our children are overweight. So clearly we have something going on. Weight loss is the number 2 reason patients come to me. Fatigue is number 1. There are multiple factors that lead to weight gain, multiple factors that play into resistant weight loss. Reducing inflammation is key to weight loss. And the number 1 organ that perpetuates inflammation is the gut. The number 2 organ is belly fat. So you have this nice harmony of dysfunction, if you will, between inflamed gut due to multiple food sensitivities, gut dysbiosis or bad bacteria or yeast growing in the gut, and malnutrition, plus this visceral belly fat that's highly inflammatory and frankly toxic. So it's a perfect storm of disease. As I look in the future, my practice really focuses on a concept that I call life change through wellness. What we do is high-performance healthcare, and we really seek to restore physiology and allow people to live the life that they choose to live, have vitality. I think of wellness as a financial statement. You have your assets and your liabilities, and your income and your expenses, and that all leads to your net worth, and your net worth is vitality. But why do you want vitality? Because you want to live your dream. And I know that the wellness concepts that I have applied into my life and into my home have radically changed the way we live. And we are living our dreams. And it's fantastic. When patients return, they have a variety of things to say. A common thing that they say when they first get their ALCAT test is, wow, that's surprising. One concept that I've learned in doing functional medicine is that everything I thought I knew was wrong. And that's what I have to teach my patients. The way you eat may not be right. The things you think are healthy may not be healthy. And the ALCAT test helps them to discover what is immediately relevant to their diet. When they come in after they've applied the test, they are universally pleased. The weight loss that they have is not rapid. Many of them that are what I call very toxic do tend to have some rapid weight loss as they reduce that inflammatory load in their body. Then it slows up to 1 or 2 pounds a week. And they have incremental, persistent weight loss, incremental, persistent improvement in energy, incremental, persistent reduction in arthritis, in gut pain, in fatigue. Sex drive improves. Overall outlook on life improves. It is almost a rule that when patients come back to me for a 6-month visit, they have taken themselves off medications. My name is Dr. Jamie Wright, and my practice is called the Centers for Balanced Living. And patients can reach me by calling 1-800-604-1402.